While so many of us would like to lose some weight, doctors will say that our overall health is much more important than, say, a number on the scale. But that's exactly why we are talking to the professionals this morning from Valley Medical Weight Loss. We actually want to talk about restoring balance, energy, and confidence through hormone replacement therapy. And quite often, weight loss ends up being a side effect of these kinds of treatments. So joining us this morning, Dr. Ebraham Jatta from Valley Medical Weight Loss, along with Anna Galvan. Anna, you are Dr. Jatta's patient. Both of you, welcome to Your Life, Arizona. I really appreciate this conversation. Anna, let's dive right in. I want to start with you. Talk to me about, you said you were in your late 30s, early 40s. Talk to me about what you were experiencing, what you were feeling.
Hot flashes, mood swings, depression, anxiety,
brain fog.
Insomnia, brain fog, fatigue.
Weight gain.
Weight gain, absolutely. Yeah. And I just,
You know, it's funny, you and I were talking before the segment, and I'm adding to your list along with you because so many people are suffering. So that's exactly why, Dr. Jatta, let's talk about hormone replacement therapy. For folks at home who aren't familiar, what is that exactly?
So hormone replacement therapy is actually a medical treatment that we provide to our patients because as time goes on or with age, hormones tend to be deficient in most men and women. Our ovaries or testes or adrenal glands start to decrease the production of this hormone. So we are able to provide therapy by replacing the hormone that is gradually decreasing to optimize that level by giving you a bioidentical hormone replacement therapy.
It's amazing when you replace the hormones because that affects literally everything that Anna was talking about.
Correct.
You did mention a bioidentical replacement therapy.
Yes.
What is the difference between that and hormone replacement therapy?
So bioidentical hormone replacement therapy is actually derived from plant-based, meaning the chemical structure in that hormone, for example, let's say estradiol, testosterone, progesterone, is more identical to our naturally produced hormone that our ovaries make, or testes, or even the adrenal gland make.
So when our lab results come back as normal, and we know that there is something terribly wrong, how do we know when the mood swings, the fatigue, the weight changes are actually related to hormones?
Lab work can come normal, and then you still have those symptoms that you just described. Now, we know that when it comes to perimenopausal or menopause or andropause for guys, those labs can still be normal, but symptom presentation still exists for the patients. Now, symptom is key here rather than just the lab work. Lab is just there to actually help us kind of get the baseline as to where do we start before, where is the lab, what's the lab level now before we start any therapy? And also as we proceed through the therapy, we can also look back and say your lab levels were very, very low or perhaps normal in the bottom range, but now lab has improved, but symptom also has improved with the lab.
Okay. Let me ask you, a lot of people have heard of hormone replacement therapy and are concerned about the safety. What would you say to those folks?
Yes, safety, we take that very, very seriously, and we always discuss the benefit and also the risks associated, and also in terms of the safety with regards to replacing hormone replacement therapy. We want to make sure we fully check your lab panel, which is a comprehensive lab work, but also looking deeply into your medical history. That helps us to guide to actually determine whether the patient actually qualifies for hormone replacement therapy.
Right. Okay, so you make sure that you get the exact level that each individual needs. Anna, let me give you the final word on this. For somebody who's at home watching, maybe they've been suffering, maybe for years, like you did. What would you say to that person?
I would, first of all, there is hope. There is more than hope. If you, even the slightest symptoms in the beginning, because only you know your body and you know what's normal and what's not, just seek medical attention. There is so much out there, and just don't let it overtake your life.
And we're not alone, are we?
Yes, absolutely. We are not, you are not alone. There's a lot of women.
Anna, thank you for your willingness to tell your story. Dr. Jatta, thank you for the work you do in helping people. Really appreciate it.
Thank you.
And right now, Valley Medical Weight Loss has a special offer for Your Life Arizona viewers. You can get a free 15-minute consultation or save more than 50% on blood work and a comprehensive consultation. For more information, you can visit them online or call the number right there on your screen.